at cells and see whether the cells is cancerous, right? So I'm supposed to be in a position to immediately get a biopsy in my same little office space, stay in the slide, look at the cells and say, oh, this is cancerous, or this is that, or this is this. Or if a patient comes and they have an infection, I studied microbiology. So I'm supposed to be able to at least conduct certain tests immediately using my knowledge of microbiology or my knowledge of pathology to find out what is wrong with my patient. Right or wrong? Because you learn that. I learned that, man, you have to pass that. If you don't pass it, then you cannot graduate. How you mean that you're going to go through all the basic sciences and you don't even understand pathology and histology and all these things? You have to pass. Now, after you pass, if it is that we use that, we'll be able to produce a better type of healthcare. Because I saw a lady and she went to the doctor. She had a mass in her stomach and they took a biopsy and she has to come back in a couple of weeks, or next week or 2 weeks or whatever. I mean, somebody's sick. Every single day that the person don't get attention, it makes it worse. So if in case that you even use the knowledge that we learn, just be in a position to use that knowledge, utilize that knowledge, then instantly you could have said, okay, this patient, this cells has too many, this, that, whatever figures, bodies, whatever it is, it means that it's supposed to be leukemia, whatever it is that it is. Because we studied that. Now, the system is divided in a way that it's called like it's division of labor, right? So even if you study that, the only thing, if you go to a hospital or an office to work, the only thing that you are in the capacity of doing is prescribing. You understand? Because you have technicians, right? You have, if you need to go and take a blood work, you have to go to a lab, right? They have to pay a set of money to the lab. Then you have to come back to the doctor to study. Why? Because within the system, there is not sufficient time. There is not sufficient time allotted to the care of the patient. How much time is it that you sit down and you speak to your physician and then you understand whatever your problem is? Any of you have diabetes? You ever sit down and you explain that good to you? I mean, that's a good. Speak to you. That is exactly what it's supposed to be. When you leave, some people go to the doctor and then they get their prescription and they're gone. And you know, so some of them would not drink the prescription. Right? They'll put it they'll buy it. And they'll put it someplace. They'll go to the doctor, buy another set and put it someplace. You don't believe me?
Yes, true.
Right? Why? Because of the fear of the money the world could. You're afraid that you will not be willing to see you again if you're sick. You're afraid that if you say something, he might give you something, and people that say that, you know, give me something and put me down. No. You speaking to your physician is making him a better physician. You expressing yourself to him makes him better. Because if you ask him a question and he can't answer the question, he has to go back to his books. Because he's human, you know. Most of them, if you ask them, most of the things they studied at school, they won't remember. You understand? They won't remember 10% of most of the things that they studied. Why? It's not something that they practice every single day. What they do every single day is a prescription of drugs. Now, if you are Bible loving and you see, well, God said that your medicine shall be the leaf of the tree, herbs. People have so much confidence. We have developed so much confidence and so much reverence to the establishment of medicine nowadays that we don't question it. We have blindly abandoned what our foreparents did for the past 100, 200, 300 years. And we have adopted a system, right, that has proven to be ineffective. And we refuse even to question that system. Go on. Your grandparents, a great-grandmother, you have over 180, 90 years old. You see in Dominica, you see lots of old people walking around. Eh? If you go to St. Lucia, you don't see that. If you go to Barbados, you don't see that. St. Martin, you don't see that. Tortola, St. Croix, England, you don't see that. What you see in Dominica of the old people, and all the old people you see, they skinny, they thin. I mean, if you want to live to 100, the first thing you're supposed to say, you know, why? I see, eh?
I said we don't say old people anymore.
Age. Pardon me. The elder. Right? Or aged people. Elderly people. Right? Now, when you really look at that, but they are ancient for sure, you know. When you get to 100, it's like you are ancient commodity. You precious. You have to look at them, the encyclopedias. You know, so when you look at them alone, look at the size. You don't see any one of them. You understand that? So if it is your aim to be over 100, at least if you look at the size and you say, boy, I have to get to that size. Right? Because they have been doing something that can keep them alive. And they have hardly gone to a hospital. You understand that? They have hardly gone to a hospital. So I am telling you that, okay, this is the system that we have had. That's the system that have produced people over 125, 127. What's that system? The system whereby Dominicans use their herbs when they don't feel good. And they consume more of their indigenous foods. The foods that they grow. Dominica is among the only country in the Caribbean where you all ban spraying of bromoxamine. You're doing good, you know, when it comes to nature. But it seems like you all care more about Dominica than about yourself. So if it is that you put laws to stop the spraying of bromoxam, right, that it won't go in the river because it kills the river, it kills all the living organisms, why is it that you don't put laws to keep your physical structure alive? Coke is like Domoxin, Coke, Sprite, Pepsi, and Coke. It's just like the bromoxam that you put in the earth. So when you look at that whole system, I mean, point blank, if anybody say I'm wrong, I mean, you could tell me. But the way that the ancients used to take care of themselves was giving better results than today. Right or wrong? Right. Now, what is it that we now supposed to eat? Even the ancients lived to 125. I'm saying you could live to 200. There are, let's see, that even like a joke now, yeah? 200. Let me see if I get to 20. It looks like a joke. I heard a young man say, boy, when I reach 40, I'm good, you know. Yeah. Which is just, I mean, people here reach 120. When the man reach 40, right, you have 2 more 40s to go. And then he's ready to kick out. Yes, but that is the mentality of people. So, people live 200 years just recently in Kemet. When you study what we call the coprolife studies, when you study the shape of the teeth, all these people's teeth had no cavities. When you study the solidified feces in their intestines, what they consume was more fruits, nuts, grains, and vegetables. Not even vegetables per se, more fruits, nuts, and grains. You don't need to buy a whole heap of broccoli and cauliflower here, you know.